All right. Hello, everybody, and welcome to the virtual dementia session for this month. My name is Kelly Parsons. I work alongside Sarah Hatch. We're really excited today to hear from our good friend over at Legal Aid, Angela Zeek. Angela is a paralegal at Legal Aid of the Bluegrass. She works in public benefits and is the ombudsman manager. Um, just a FYI, we're going to send out a recording of this along with Angela's slides. She's been gracious enough to give us those, so we'll send that out along with the recording. There will be time for questions, but certainly if you have any during the presentation, just put them in chat and I'm going to unmute. And Angela, you are a co-host, so you should be able to share your slides. But if not, I've got them up and can do that as well. There we go.
Okay. Thank you so very much, Kelly, and thank you all for joining us today. I'm happy to be here to tell you a little bit more about Legal Aid of the Bluegrass and about the Medicare SHIP program, and happy to answer questions that you may have. And if I don't know the answer, I will make sure that I get the answers to you. So let's go ahead and share the screen. If you'll give me just a moment, I'm going to get that up here. Okay. So today we're going to focus on Legal Aid's Medicare SHIP program. We're going to talk a little bit about Legal Aid and go over some information about Medicare benefits and the upcoming Medicare open enrollment. So Legal Aid of the Bluegrass is a nonprofit organization. Our job is to assist individuals living at or near poverty with legal issues, including housing, consumer-related concerns, family-related issues, including domestic violence, government public benefits work. We also have a new low-income taxpayer clinic. We have an attorney that provides assistance with people who are in dispute with the IRS. We have a number of clients ranging in a variety of ages that are dealing with issues. So, you know, the one thing that I want to make sure that people take away from today is our contact information. If there is a legal concern, please don't hesitate to call us. Now, our job is to assist with civil cases. We are not the public defender, so we don't handle criminal law. But if you need something like life planning documents, which include a power of attorney document, a last will and testament, a living will, then those are things that we can provide. Because we are federally funded and we have a number of grants that we work under, our services are offered at no cost. We do have a few ways that you can reach us. We have our phone number that you see on the screen, 859-431-8200. We operate our hours a little bit differently. We have live intake Monday through Thursday from 10 until 3 and on Fridays from 10 until 1. But we also just rolled out our online intake on our website at lablaw.org. So you are able to reach out to us if you have access to the internet and want some assistance and you can't get through our telephone line. Inside Legal Aid, we have a number of programs. I mentioned our low-income taxpayer clinic, but we also have the Medicare SHIP program. SHIP actually stands for State Health Insurance Assistance Program, which doesn't really give you any information about who we are and what we do. It's a little confusing. Most people think that we only work with state retirees or state employees. And although that is true, we do work with those groups. We also work with people on Medicare, people who are age 60 and older, assisting them with their government benefit related issues. Our staff are the only staff in Kentucky and across the nation that are trained by the Centers for Medicare and Medicaid Services. We just call them Medicare, and other reputable organizations, including the National Council on Aging. We're very fortunate to be Kentucky's one and only benefit enrollment center that allows us to expand our services and provide additional support to our communities. Our job through the Medicare SHIP program is to make sure that people are informed and can make good decisions about the programs that impact their quality of life. And those programs in particular are Medicaid, Medicare, Social Security, and other insurance that works with Medicare. We are not an insurance company. We're not associated with an insurance organization. We do not work on a commission. This is all a federal program. We receive federal funding. Our federal funding is not through the Older Americans Act, like we receive our legal assistance for the elderly, which is defined as 60 years old and older by the federal government. But we do work very closely with our Older Americans Act programs. So our job is to conduct presentations, much like what I'm doing here today, provide informational material on changes to the benefit programs so the communities and individuals are knowledgeable about how their benefits are going to change. We help compare Medicare options and assist with Medicare enrollment when possible, and we assist individuals with complex benefit related concerns. The individuals that work within our particular unit here at Legal Aid are trained paralegals, and so they have a significant amount of training on the state and federal regulations, and we know how to work with those when we talk about the governmental agencies that that are responsible for administering these benefit programs. We also work very closely with our legal aid attorneys. There are some times where our paralegals cannot resolve those concerns on behalf of our clients, and we can transfer them to an attorney that can represent them in a court of law if that is what is needed, or in a court, an administrative court. We also screen for eligibility and help complete benefit applications for those money saving programs. Some of those programs include reducing the prescription drug costs that through the Medicare Part D prescription drug benefit. There are also programs that help lower the Medicare Part B premium for individuals. So when you contact our organization, we're going to conduct that screening, and you may not even be aware that we're doing that. We're going to ask you specific questions, and we're going to help try to plug you into all of those programs that we feel that you are eligible to receive and help you gain access to that. So our most notable work last year during Medicare open enrollment, which I'm going to discuss more in just a moment, we helped our clients save roughly $1.4 million by helping them to compare their Medicare options. So far this year, from January to July, we have helped to apply for $1.2 million in money saving benefits. We've spent a significant amount of our time this year helping SSI recipients gain access to Medicare Part B. I'm sorry, Medicare Part A. There are a number of issues that SSI recipients encounter with the Medicare benefits in particular, and we have been working with our state Department for Medicaid Services to make sure that they have everything that they need in order to have access to both parts of Medicare. We've also assist our clients who have both Medicare and Medicaid with balance billing issues. There is federal law that requires providers not to balance bill, which means not to bill the beneficiary for services should they have both Medicare and Medicaid. This happens quite frequently, and our clients end up paying the bill, but providers are not allowed to conduct that balance billing. So we have worked very diligently in trying to educate providers in our service region to make sure that they are aware what the law actually says. So we're going to jump right into Medicare benefits. I want to make sure that we have enough time for questions. I know I might go through this information pretty quickly, but hopefully we can kind of clarify or fix any confusion that I might cause as we go through these slides. I have on the screen the logo for the Department for Health and Human Services. When you receive information from Medicare, you're going to see this logo on the envelope or on the letter. You want to pay very close attention to the logo because there are insurance companies, organizations that will mimic this logo. But to know if it's a true document from the government, you want to make sure that it has the appropriate logo. If there's anything in there, any of the material that you receive that tells you to call a number that's not 1-800-Medicare, has some other kind of number on there, a 1-855 number, for example, then that's probably associated with a company, not with the federal government. So be very careful. Um, so to understand Medicare a little bit, you got to know that what the four parts of Medicare do and what services they provide. So not every individual is going to have all four parts of Medicare. Most people will have Medicare Part A. We call that hospital insurance, but it also pays for things like skilled nursing facility care, hospice care, and some home health services. Medicare Part A does have a deductible. It's a very confusing deductible. We can talk more about that if you want more information, but it is not an annual deductible. So you could potentially pay that Part A deductible multiple times per year, depending on how you're using the Part A benefit. There are co-payments and co-insurance amounts associated with Medicare Part A, and Medicare Part B is considered a voluntary insurance program. You do not have to enroll, although there are very few times in which someone should not enroll. But we consider this your medical insurance. It's basically paying for medical services that's not covered by Medicare Part A. So your outpatient services, ER visits, labs, x-rays, preventive services, durable medical equipment, and there's a whole long list of other services that it provides. There is an annual deductible associated with Medicare Part B, and after you meet the deductible, you have a 20% coinsurance amount. Medicare Part B has a monthly premium that is paid, typically out of the Social Security retirement check. However, some people are paying that premium directly. Medicare Part A does have a premium, but as long as you've worked and you've paid enough into your FICA taxes, you're getting that premium free. But some people are not eligible for premium free Part A benefits. And SSI recipients could be one of those larger populations which typically don't have Part A for free. Then we have Part C of Medicare. We call that Medicare Advantage, although some people call it Medicare Replacement or Medicare Health Plans. And then we have Part D, which is the prescription drug coverage. So today I wanted to focus a little bit of time on the differences between Part C of Medicare and Part D because open enrollment is coming up and we see a lot of confusion during this period of time. And so I wanted to make sure everyone clearly knew what these two benefits were and how they work. So Medicare Advantage, sometimes called MA plans, is another way for people to get their Medicare benefits. It is insurance that is offered through private companies that have contracted with Medicare to take the place of the original Medicare benefit. People are still enrolled into Medicare. You still have all the rights and protections as a Medicare beneficiary. But once you enroll into a Medicare Advantage plan, you're not showing your red, white, and blue Medicare card to your providers. You're showing your company insurance card to them. Now, a Medicare Advantage plan can include prescription drug coverage. There are some that don't, but most do. And not every plan is offered in the same county. The plans are able to determine their service region. So you might be living in Richmond, but you have a sister that might live in Somerset, and those two counties will have different insurance options. So you might have something available to you that your sister does not. You have to see the network, or stay within the network, see the providers that are part of the network for the most part. Some plans offer some flexibility where you can go outside of the network. It just costs a little bit more. And these plans are allowed to charge different costs, out of pocket costs. So for Medicare Advantage, you will have out of pocket costs, but they do shift what you are going to be charged and your responsibility to pay, which makes it a little difficult to kind of compare to original Medicare. They cannot charge more for things like chemotherapy, dialysis, and skilled nursing facility care, but they can change how often that service is offered. They can offer extra benefits, and you'll see commercials that talk about the vision, the dental, the hearing benefits that they offer. They often offer a fitness and well-being benefit of some sort. And they also have a yearly limit, an out-of-pocket limit. Now, what I like to tell our clients when we are comparing that coverage, we really don't spend a lot of time focusing on what that out-of-pocket limit is because Medicare allows the plans to determine which medical services count toward the limit. And it's extremely difficult for us to find what counts toward the limit and what doesn't. So we look first at how the plans cover medication and other services before we look at that out-of-pocket limit. There are several different types of Medicare Advantage plans, and we often find that our clients are confused regarding what kind of insurance coverage that they have. So if you have a Medicare card that you're showing your doctor, if you look at that card, in the name of the card of the plan that you're enrolled in, will indicate which of the Medicare Advantage plans you have. So we have HMOs or health maintenance organizations where they provide a more limited provider network. If you go outside of the network and it's a non-emergency, you're probably not going to have coverage. You have to have a primary care doctor. You have to have referrals to see a specialist. So it's a little more limiting in the services, meaning you have fewer options. PPOs, or preferred provider organizations, are more flexible. They're the ones that are offering the out-of-network providers that cost a little bit more. You don't have to have a primary care doctor, and you do not have to have a referral to see a specialist. We have private fee-for-service plans. We have very few of those offered in Kentucky. These are a little difficult to work with because the network can change and change suddenly. So when you enroll into a private fee-for-service plan, you need to make sure before you receive services that the provider is actually going to take the insurance. We have special needs plans that are earmarked for special populations. Our special needs plans are available to people who have specific chronic conditions that have been set up by the plan to accept as a member, individuals who have both Medicare and Medicaid, and those that are residing in a nursing facility. We also have medical savings accounts. We only have two in Kentucky, and that is an insurance plan that has a very large deductible. It comes with a savings account in which they deposit a specific amount of money into that account at the beginning of the year, and that money can help you spend down or reduce the deductible. And then once the deductible is met, the insurance plan will pay for your services. So Medicare Part D is the prescription drug benefit. It is optional. People on Medicare have the opportunity to decide if they want to enroll into coverage or not. It is my opinion that everyone should have a Medicare drug plan if you're on Medicare and you don't have access to other prescription drug insurance. The reason is there is a lifetime penalty if you do not enroll into that plan when you first become eligible, and it can become very expensive. So I try to explain that this type of insurance should be viewed very similarly to a homeowner's policy. It's there when you need it. So if you're not on medication and you're enrolling into Medicare, make sure you get into a plan, find the cheapest one. You're able to make changes each year, but at least you're protecting yourself just in case you need it mid-year. But these plans are offered also by private companies that contract with Medicare. We have standalone prescription drug plans that work with original Medicare, and then we have drug plans that are embedded into the Medicare Advantage plans. As I said, this is optional insurance, but I do encourage everyone to enroll if you do not have access to other prescription drug insurance. If you have a former employer plan that you have, or you have military benefits, you have state or federal retiree benefits, then you don't need to consider enrolling into Part D because your coverage is considered credible. But for other individuals that have no access to other insurance, you need to enroll into a Part D plan. And if you're someone who has Medicaid, then Medicaid is not, and you have Medicare, Medicaid is not going to cover your medicine, so you still have to enroll into a drug plan. These plans are consistent across the entire state. They're offered in every county. The plans are structured in a way in which they have a formulary, a list of medicines that they are willing to pay for. They are required to offer coverage for each therapeutic category of medication, but they're not required to cover every single medication that's on the market. That's why it's extremely important that you compare policies I know we are creatures of habit. We kind of gravitate to the companies whose names we recognize, but you might find that a company that you do not recognize, a name you do not recognize, offers better coverage for your medication and might be cheaper. So you do need to compare each year and don't stay with the same policy from year to year. I've had clients do that, and it was extremely expensive for them. Out-of-pocket costs may be less if you use preferred pharmacies. That's another way to, kind of shop around the pharmacy, around the to the pharmacies and find the one that offers a cheaper copayment or coinsurance amount for your medication. And some plans do change each year. Well, most plans do. They can charge an annual deductible. They can lower the deductible, but there is a standard deductible that is set up in the regulation. So that is going to change, and the companies are allowed to charge that full deductible. They can charge copays or they can charge coinsurance amounts. The plans determine, they have that flexibility to determine what they're going to charge for the medications and when they charge the medication. They might start off charging a copayment until you reach a certain amount, and then they might go into copayment, or they may charge copays for your generics and coinsurance amounts for your brand name drugs. Again, another reason why you should compare your options each year. If you have limited income and resources, there is something called Extra Help or Medicare Extra Help. That is the program, a federal based program that helps individuals to lower their monthly premium. It could eliminate the deductible. Well, it does actually eliminate the deductible. We had some changes with that benefit not too long ago. It eliminates the deductible, and it reduces the out-of-pocket costs at the pharmacy to very small copays. Okay, so Medicare open enrollment starts October 15th and it ends December 7th of each year. And this is typically the one time per year for most Medicare beneficiaries to make a change to their prescription drug coverage or to their Medicare Advantage plan. Any change that's made during that period will take effect January 1st. People who get extra help actually receive some additional opportunities throughout the year to make a change to their insurance. But we don't want people to be, in this group here that you see where it says 7 out of 10 Medicare beneficiaries do not compare plans each year. And because of that, they're overspending on the medication. So don't be one of those people this year. I think of all years, this is going to be a year where people really need to be vigilant and they really need to make a change to the insurance. We do offer comparison assistance. You see our phone number there on the slide. And when you do call us, when we please expect for us to ask you a number of questions. Because we're on a federal grant, there's certain pieces of information we need to collect. And for us to provide you the best service we can, there are pieces of information that we need. If you need a comparison, we will most likely send you a Medicare comparison request form, ask you to complete that and return that to us. We will begin receiving or accepting Medicare comparison requests on September 8th. But we can't work on the comparisons until October 15th. So there is a little bit of delay, but we have a great group of people who are helping us out, work within our unit to really get that information out to you. And I think it is pretty comprehensive. We're going to give you options to consider. Again, we don't partner with any of these insurance companies, so everything we're giving to you is based on information given to us by Medicare. You can also receive assistance, comparison assistance, by calling 1-800 Medicare, by going to Medicare.gov. If you are going to work with a sales agent, make sure you're being very selective with the person you're working with. Typically, if the person's local, they have their reputation is on the line. So if they do not do a good job for you and you're out in the community and you're being vocal about that, they don't like that. But we will see a significant amount of fraud happening in our region. So our words of caution to you is marketing for Medicare open enrollment begins October 1st. You're going to get a ton of calls. You're going to get a ton of information in your mailbox. That logo that I showed you earlier, you want to be very careful. Make sure that's on the material that you're receiving. You should receive information from your current prescription drug plan or Medicare Advantage plan, an evidence of coverage document, an annual notice of change. All of that is important information for you to review, but it's usually small print. Those are pretty thick documents. It's hard to wade through that information. So even if you get that information, if you're struggling with wading through it, definitely call us. We're happy to help you. But we have seen over the years a significant amount of fraud with people coming to your door, calling you unsolicited, approaching people in common areas, and all of that violates the Medicare marketing regulations. No one can call you unless you ask them to call. No one can come to your house unless you ask them to come to your house. They should not be approaching you in common areas at all. So just be careful. If they are approaching you, then chances are they're looking to make money, and no one can fault someone for trying to make money, but they may not have your best interest at heart. They may fail to tell you how the plan's going to actually work for you, and then you'll find out in the first of the year that it doesn't cover certain medications, or there's a number of issues or obstacles in getting medical treatment that you need. The other thing is to be very careful is that there is a play on words sometimes. People will call Medicare Advantage a supplement policy. It is not a supplement. Medicare Advantage replaces original Medicare. A Medicare supplement or a Medigap policy works with original Medicare only. Those plans are named after letters of the alphabet, which makes it a little more confusing because we have letters of the alphabet within Medicare. But if someone's saying, oh, I've got the perfect Medicare supplement for you, it only costs $24 a month, That is not a supplement. Medicare supplements are based typically based on your age. They're based the premiums are based on your age. They're based on where you live, and they're probably not going to be under $100 a month. So be very careful. Also, we do know that there was a recent change this year in the payment rates to Medicare Advantage plans, and we're expecting about $15 billion being transferred from the federal government to Medicare Advantage plan companies. When we talk about that type of money, there is an increased risk of fraud. People are going to really want to get you to change your insurance in order to get the commission. Not everyone. There's good sales agents, there's bad sales agents, just like there's good and bad in every profession. Just be very careful. And if you're out there doing research on your own, which I hope you do, please be cautious of imposter websites. Government websites end with .gov. If it says Medicare.com or Medicare.org, that is associated with a company, not with the government. So be careful and always compare. Even if you love the plan that you have, uh, I guarantee you there will be some kind of change, and you need to be aware of what that change is. So always compare October 15th to December 7th each year. And on your screen now, you see our contact information, both our phone number and our email address. We have 4 offices within our service region. I have one in Lexington, one in Moorhead, one in Covington, and our last is in Ashland. You are welcome to stop by our office at any time. We might not have staff there that's able to meet with you at the time you stop by, but if you need to pick up a Medicare comparison request, for example, we'll have those ready for you. You can come in and pick them up, and you can mail them back to us or drop them back off to us, and we're happy to help you any way that we can. So I don't know how fast I went through that, Kelly. I hope we have enough time for questions. Happy to to clarify anything that I've said or kind of expand on any of the other Medicare benefits or other money saving programs, whatever anyone needs.
Awesome. That was fantastic. And so much great information. And I really appreciated the logo. I didn't realize that was another way some people who don't have good intentions are able to sneak by you. A couple of questions in the chat. The first one is, what counties do you serve?
Oh, that's a great question. So, if you were to think of the map of Kentucky and you cut it into fours, we're that upper right-hand quadrant. So from northern Kentucky all the way down to Danville, and then all the way over to the state line with West Virginia in the Ashland area.
Then, oh, whoops, sorry. And then another question was, do you have to meet the income requirements to use the comparison assistance program?
Oh, absolutely not. So we have Uh, the money saving programs do have income and resource guidelines associated with them. To be a client of ours, to get help from us for any reason dealing with your benefits, you just have to be 60 years old or older, or on Medicare and living within our service region. If you like to have a complete list of the counties that we cover, you can go to Lab Law Legal Aid of the Bluegrass is what that stands for, lablaw.org. But if you are, in Louisville, for example, on today's call, go out to kyjustice.org. That's where you can find a list of all of the legal aid providers in the state. And then the Cabinet for Health and Family Services is who houses the state or the SHIP program across the state. And you can find a list there. I am happy to get you all of those resources, Kelly, if you can get those sent out. But I'll type out where they can find their local SHIP. Matter of fact, I might be able to get the phone number and put it in chat for the SHIP program in particular. Because there is a statewide phone number. Yep, here we go. If you don't live in one of our counties, then you can definitely call this number and going into chat now, and they can provide you with the contact information for your local SHIP program. A matter of fact, I'm going to link the website so you can also search that website for your local SHIP program. And for your local legal aid provider, you can go to kyjustice.org. And there's a lot of good legal information out there on kyjustice.org as well. So if you have questions about the power of attorney document, for example, or what does a power of attorney document do? What's a guardian? There's lots of good information out there.
That's great. And sorry, I just lost my train of thought, but Mickey's asked, if a relative you care for lives out of state, but you live in Kentucky, are you able to use legal aid here for their needs?
Unfortunately, no. The service, it has to be provided where the person is, but it would be a legal aid provider for that state. I'm not aware of maybe the Legal Services Corporation website would have a link to all of the states and their legal aid providers. You might be able to drill down to the local legal aid provider for that region on their website. I've never tried that. I'm sorry. But I will link their website out here in chat as well.
And then just out of curiosity, so somebody calls legal aid for maybe Medicare comparison or another, or will, things like that, how long should they wait, or when should they expect a return call? I know people can get really, really busy, especially this time of year.
Yeah, so for our organization, I can answer that for our organization. For other organizations, I don't think I'm going to be totally off base here. So when you come through intake, the case is typically transferred to an attorney, and the attorney then will reach out. It might take a few days, but it shouldn't take very long. Usually those life planning documents we can get done very quickly. If it is an emergency, there are many times where we're contacted by like the hospice social worker or dialysis social worker, and we know that it is quite urgent. People need services. People need to get things in order. We can act very quickly. So I don't think I'm off base across the state saying it is usually a very quick turnaround. I know if you are living within our service region, we typically do will clinics at our local senior citizen centers during the summer months when we have some assistance with our law clerks. And so that's another way if you want to just kind of keep an eye on that. But you can call us anytime. You don't have to wait until there's a wills clinic in the county. You can just call us, call any legal aid provider whenever you need the service. Again, we all receive Older Americans Act funding. It's called Legal Assistance for the Elderly funding. And so we have special funds that allow us to provide services, especially for those to prepare those documents.
That's fantastic. Does anybody else have any other questions? You can certainly feel free to unmute and ask them. Oh, we've got another one in chat. Okay, other than not needing a PCP referrals, etc., and being able to use non-network providers, have you determined if there is a difference in benefits over HMOs?
Right.
HMOs versus, yeah, thanks, Nikki.
Versus a PPO.
Yeah, no, I knew where you were heading with that. So typically the HMOs come with no additional premium, and the PPOs typically do. Now, this year was the first year that we saw no premium PPO plan. I think we might have one or two this year. Um, you know, the networks for the HMOs are somewhat limited. And so if you're not traveling at all, and you're staying within your home county, you're probably not going to have any problems with that. But if you're traveling, even if you're in Louisville and you're traveling to Paducah, you might have some concerns with getting services if it's not emergency. I had a client one time who traveled here from South Carolina, fell and broke her leg. She had to have surgery. The surgery was covered because it was an emergency. She stayed here and received therapy, and the HMO did not pay not one dime. And they said she could have got on a plane, flew back to South Carolina, and received therapy there. Well, I think that's quite difficult, but those are the issues that we kind of see with the HMOs. There's really no give there. So the PPOs, you have that flexibility of going outside the network. Medicare Advantage plans in particular, you need to be very careful of, because they're skilled benefits. We've seen them become more restrictive with the
Can
services
you explain
provided.
what skilled benefits are?
Yep, yep, I sure can. So,
Sorry.
no, that's okay. So the skilled benefit under Medicare is when someone has received, they've had a 3-day qualifying hospital stay for whatever reason, they've had surgery or whatever the case may be, and they need intense therapy, physical, speech, occupational therapy. They can go to a skilled wing in a hospital or a skilled bed at a nursing facility and receive that high intensity therapy. Under Original Medicare, a person can receive 20 days of therapy at no cost, and then starting at day 21 to day 100, there would be a daily copayment rate. What we're seeing through the Medicare Advantage plans, both HMOs and PPOs, is that they're limiting, they don't want to pay for the full 20 days. And so I had a client be discharged from a facility from her skilled bed at a nursing facility after 3 days because she didn't know that she could appeal that decision. The plan was denying coverage and she didn't understand that she should appeal. So if you are in a Medicare Advantage plan and you are getting skilled therapy in particular, or any service that the plan is denying, don't take their word for it. Appeal, appeal, appeal. Go through the entire appeal process. You can't appeal with Medicare because you have to appeal with your Medicare Advantage plan. So there you might have some different rules than what a person with original Medicare would have. Just don't take their word for it. Keep appealing it, especially if you feel like you need the service. I am watching, we have the long-term care ombudsman program in the East. We have 10 counties in the East that we provide services to. And I have been in contact with a lot of our administrators, and I've had administrators tell me that they're not accepting specific Medicare Advantage plans because they will not pay. I do think, we've seen some plans make some changes where they're starting to restrict those extra benefits that they offer, or they're not even offering the extra benefits any longer. So if you are in a Medicare Advantage plan, you need to pay very close attention about how your plan might be changing next year. We have had a number of issues in the state, with St. Elizabeth in Northern Kentucky, with Baptists across the state over the last couple of years, where they have tried to negotiate payment with the plans and they haven't been able to agree. And so there have been some providers not accept insurance. And we typically learn about that between now and September. Um, when we learn about that because it's released to the public, and our clients start calling us saying, "Hey, Baptist says they're not going to take UHC any longer, or they're not going to take Humana any longer," and so then we start investigating it. I haven't heard about these negotiation breakdowns yet this year, but that is something, if you're being alerted by your provider, you need to pay close attention to.
And then another
So,
thing, I think I want to just a clarification on if I choose a Medicare Advantage plan in open enrollment and I go through that whole year and the next open enrollment period, can I go back to original or traditional Medicaid, or would I have to stay with an Advantage plan? I think is a good
That's a very
question.
good question. Very good question. No, open enrollment is your opportunity to make any change. So if you wanted to try out a Medicare Advantage plan and you decide you don't like it, you can always return back to original Medicare and pick up a prescription drug plan during open enrollment, and it starts January 1st of the new year. So you can always go back and forth depending on what your needs are. I have had some clients who are new to Medicare that need hearing aids, and we have some plans that offer a really good hearing aid benefit. So they got into the plan because they were relatively healthy, but they needed the hearing aids. They got their hearing aids, and the next year we took them out and put them into something else. So, and I'm not saying we did, their decision was to come out and go to something else. We don't make decisions for people. I want to make sure that that's clear. We just give you the options, but we do help. When you tell us you want something, we can help you to enroll into that plan. But no, you can make a change and go back and forth, however whatever you feel is best for you for that next year.
Thanks.
So Kelly,
All
I have
right.
another question.
Okay, last one.
I'm sorry.
That's
Are we
okay.
saying then that Medicare Advantage plans do not have to cover what Medicare covers?
They have to cover what Medicare covers. For example, what I mean by that is they can't say, we're not going to cover skilled care. The Medicare benefit says that they have to cover skilled care, but they can shift how that coverage appears to you. So, for example, under original Medicare, if you are admitted to a hospital, you will have a deductible. It's almost $1,700. And if you're admitted one day, you pay the $1,700. A Medicare Advantage plan says if you're admitted to a hospital, you're going to pay $500 a day for days 1 through 5. And so it's possible that you could pay more for your hospital stay with a Medicare Advantage plan if you're there for longer than 5 days. So they have to cover what Medicare covers, but they can charge you, and they can't charge more for the benefit, but they can for certain benefits, but they can try to restrict your coverage with that skilled benefit in particular.
Okay, thank you. I understand that.
Yes.
Is the appeal of Medicare Advantage plans then the cost, because Medicare actually pays that to the insurance company under the Part B benefits, whereas a supplemental plan or a Medigap plan to supplement the Medicare benefits exclusive of the Advantage plan, you have to pay for. Would that be accurate?
So the supplement policy is a premium, an additional premium that you pay to the company that
Right.
sold you the policy. And it picks up, depending on the policy you have, could pick up 100% after Medicare drops off or leaves off. Supplement doesn't work with Medicare Advantage, so you can't have both. You
Right.
can only have Medicare Advantage. But when we talk about appeal, it could be a benefit denial. So, for example, someone wants a specific prosthetic leg, and the insurance company denied that, for example, then you can appeal that decision. If it is the company saying, well, we think that you don't need any more skilled services, you've only received skilled services for 5 days, then you appeal that decision. If you feel like you're being charged more than what the plan allows, then you can appeal that as well. So the appeal process is really something I think few people follow. They don't do because they don't understand it, but they should be very careful. If there's any kind of denial or any kind of concern about the pricing or the charging, then they should be questioning that and appealing.
Yeah, I just want to say too, they'll have like if you go to a nursing home and a skilled bed for rehab, like Angela was talking about for OT, PT, or speech therapy, whereas she had stated Traditional or original Medicare will pay for 20 days outright, no questions asked. The Advantage plans can make the facility, they'll review it every 3 days. So talking about, they look at it much closer. So what I have found is some of our participants are only getting maybe 3 to 10 days in a skilled nursing facility and then sent home, whereas original would give you that full 20.
Right, that's right.
Okay, thanks.
Yep,
All right.
that's exactly
right. This was fantastic. Angela, thank you so much again for joining us. We love it when you're here, and I'm sure Sarah might send you an email further down the road. Our next virtual dementia is going to be in November. So look for those emails going out if you'd like to sign up for that. And then thank you all so much. We really appreciate it.
Thank you all.